everyone. You're tuned into today's PIR live event, and I'm your host for today, Scott Jones. Our guest today is Dr. Randy Johnston, professor in the departments of Oncology and Biochemistry and Molecular Biology at the University of Calgary. Welcome to the PIR live event, Dr. Johnston. Before we get started, I'd also like to welcome today's viewers who are watching the live stream. It's great to have you with us today, as always. Remember that you can tweet us your questions at any time during the half an hour using the hashtag AskPIR. If there's room in your tweet, please include your name, school, or city so we can give you a shout out. I look forward to getting to those questions, but right now I'll turn it over to Dr. Johnston, who's going to tell us a bit about his research and a bit about his background. So I'll turn it over to you, Dr. Johnston. Thank you for joining us today.
Great. Thanks a lot, Scott. It's a pleasure for me to be here. Hello, everybody. I understand that students from many schools across the country are signing in. So the point of today's talk is to bring you up to date on some of the recent advances that are happening in the area of cancer research. So that's my own area of activity. I'm a professor in the medical school at the University of Calgary. Let me just give you a little bit about my background, how I came to be where I am today. And then I have a couple of slides that I'd like to show you that just give you some kind of idea about what's going on in cancer research today and a very small part of what's going on in my lab. So I'm a professor at the University of Calgary. I grew up in Canada. I was born in Saskatchewan, but mainly grew up in British Columbia on Vancouver Island, which is a great place to grow up. I did my undergraduate training at the University of Victoria. And so I got a Bachelor of Science degree there. Then I went on to do a PhD down in the United States, where I obtained my degree at Stanford University, which is in the San Francisco Bay Area. I did further training there as a postdoctoral fellow, and then came back to Canada to accept a position at the University of Calgary back in 1984, so a long time ago, and I've been here ever since. And I've done many different things in my career. Not only have I served as a professor doing cancer research and teaching classes, but I've also helped to coordinate the research program overall at the University of Calgary. I've been director of cancer research. I've been president of a genome research corporation. I've done lots of different things, but the cancer research is really where my heart is. Lots of people are affected by cancer. People in my own family have died of cancer, and there's a real need for us to find better ways to handle this disease. So what I'm going to do is to show you just a few slides. I think I only have 5 slides, and I'm going to advance through those. So great, here I've got just a couple of general comments. So many people worry about cancer, and when I was a young lad in school, if you were diagnosed with cancer back then, not completely, but to a large extent, it caused a great deal of fear, because usually when you got cancer, most often, sadly, you would die. Sometimes people could be cured, but it wasn't very common. But researchers around the world have devoted a lot of attention to this disease, trying to find out how it differs from other types of disease, what varieties of cancer exist, breast, prostate, lung, gastric, stomach cancer, colon cancer, all those different types of disease, what sorts of influences in our lives might actually cause the cancer to appear in one person and not another, how we can diagnose it, and especially how we can come up with different ways to treat cancer. So, of course, we have surgery and radiation therapy and chemotherapy, but as we learn more about cancer and its many different varieties, what we're beginning to do now, and we're just seeing the introduction of this into regular clinical practice, is the development of molecular therapeutics that target the disease as it exists in any particular individual. So the generic treatments of the past, they worked okay, they're getting better and better, but now we're beginning a new era of targeted molecular therapeutics. And, people we're curing all kinds of other diseases, and people are living longer and longer. The longer you live, the more likely it is that you'll get cancer. So it's becoming an increasingly important challenge for our medical system, our financial system. It has a big impact on families, so we really have to do a lot better. So people are working on better ways to prevent cancer, better ways to detect it, better ways to educate people, better ways to treat the symptoms of cancer. But the one that I've got outlined here in red indicates that we really have to improve cancer therapeutics, the better treatment of cancer. So lots of people are coming up with, designer molecules to treat cancer in its various forms. And my lab is one of those, except we're not working on molecules, we're working on viruses. So many people think, oh yeah, you get a virus infection, it makes you sick, and your body fights it off, and eventually you get better, and maybe you can take some medicine to get rid of it faster. And it's true, some viruses, actually many viruses, can cause disease in humans, but it turns out there are some viruses that actually have the ability to go in and infect cancer cells specifically and kill them while causing minimal damage to the host, to the human patient. So here on the screen, I show a picture of one of these viruses that we are studying in my lab. It's called reovirus. So it exists naturally in the human population. It causes maybe a mild bit of fever, maybe a little bit of diarrhea. It's not very pleasant, but it really doesn't cause any severe disease in a healthy individual. So for that reason, we call it an orphan virus. But it has an amazing ability. If it somehow manages to infect a cancer cell, well, the virus grows like crazy in the cancer cell. And the reason why it does that, the cancer is growing, the virus infects a growing cell, and it takes over the mechanisms in the cancer cell that are allowing it to grow. The virus grows even faster. It takes off like crazy, kills the cancer cell, spreads through the body. Wherever it finds a cancer cell, it kills that cancer cell, and in no time at all, the cancer's gone. So here's a picture of some of the experiments that we've done in laboratory mice. So on the left of the screen, you can see a mouse that has a type of cancer. You can see that big lump growing on its leg. If that were a human, that cancer lump would be as big as a basketball. If untreated, that lump would soon kill the mouse. And then below the mouse, with a big lump on its leg, you can see some pictures of cancer cells growing in a petri dish or as extracted from that lump. And that's the same kind of fibrosarcoma. It's a kind of cancer in humans growing in this mouse. Over on the right-hand side of the screen is the same mouse treated with a virus that I showed previously. And this picture is taken 8 days after the mouse on the left. And you can see, maybe there's a little bit of fur that's missing, but basically that lump is entirely gone, and the lump has been killed by the injected virus into the tumor. And if you look down at the bottom, you can see dying cancer cells. The sections from the mouse tissue showed the cancer's all completely gone. And basically, we've cured that mouse. So that's nice to cure cancer in mice. Can we actually do it in humans? And the answer appears to be yes, we can. So now this virus is in clinical trials in humans. So people with advanced stages of cancer for whom the regular cancer therapies just aren't working, they're going to die of their disease, they're given an option of, Mrs. Jones or Mr. Smith, do you want to try this experimental therapy? Usually they say, sure, we'll try that. And so many of those people with terminal cancer have now been cured of their disease in these clinical trials. And just roughly in the middle of last year, this particular virus has now been approved in the United States and in Canada for treatment of these very difficult cases of cancer. So in my lab now, we're working on engineered versions of this virus, trying to make it even more effective, killing more kinds of cancer, killing it more rapidly, and not only my lab, but other labs around the world are working hard to try to kill as many types of cancer as we possibly can. So a big breakthrough was achieved in the 1990s, At that time, researchers passed the limit so that we now cured more cancers. Greater than 50% of all human cancers are cured. Now, with continuing advances, the number is up to probably 70 or 75% of all human cancers can now be cured by clinicians working in the hospitals, because we're developing better and better treatments for cancer all the time. So my lab is part of that story. I'm happy to answer any questions you might have. So let's go ahead. Scott, give me some of the questions that the students are tweeting in. Now, do I need to take this screen showing the slides? Do I need to turn that off?
Yeah, if you're done with your slides, just go ahead and close that then, and then we get your full image.
Sure. Okay, there we go.
Okay, very good. So yeah, that's very good to hear that so much progress is being made in the study of cancer and how best to cure it. You're right that we do have lots of questions coming in, so I'll get right to those. We have one from looks like Narula at the Middlefield Collegiate Institute in Markham, and she simply wants to know what makes cancer cells multiply so fast as compared to other cells.
So cancer cells, they actually don't differ very much from normal cells in your body. And this is one reason why it's so difficult to treat. So if you're infected by a bacteria or a fungus or a parasite, those differ from our normal healthy cells. And so you can usually come up with a drug that will kill the invading organism but won't harm you. But cancer is a betrayal of your own cells. It's like a normal healthy cell. Healthy cells have the ability to divide. Like if you cut yourself, your cells will divide, form scar tissue, and you heal the wound. That's a normal process. Well, cancer is like wound healing that never stops. The tissues start to grow and grow and grow, and they forget how to stop dividing. It's like they're trying to repair a wound, and they just can't stop. So we now understand the pathways that allow that uncontrolled cell division to occur. So it's just like the pathways that turn normal cells on and off for cell division, except they've mutated and they're always in the on position. So now people are trying to devise molecular drugs that will target those control pathways so that we can force those dividing cells that shouldn't be dividing, the cancer cells, and force them into the off position. So that's one of the strategies that people are trying to use to develop new methods to treat cancer. In my case, with these crazy viruses that we're working with, we're using another approach. We're saying, well, the cancer is already dividing, it's got its pathways turned on, but it turns out to be the same pathways that the virus uses. So we're taking those dividing cells and using their abnormality as our gateway, our entry point, so that we can kill them more effectively. So we're doing it the other way around.
Okay. I guess to follow up on that then, we have a question from the same school in Markham. Will the human body's white blood cells kill the real virus before it can attack the cancer cells? Is that something that you need to be aware of?
So that's a heck of a good question, and that's something that we do have to worry about in the clinical setting. So our body is designed through our immune system to fight off infections like viruses. So when we give reovirus to a cancer patient, it's a bit of a race. And one of the nice things is reovirus kills cancer so quickly, in 6 or 7 or 8 or 10 days, the body just barely has time to start mounting an immune response to the virus. But if the virus is a little bit slow, if it isn't killing the tumor very quickly, then the immune system jumps in and starts wiping out the virus before it has a chance to do its job. So that's why one of the reasons why we're trying to engineer the virus, so it will be even faster, get rid of the darn cancer before our body's immune system can wipe out the virus that's trying to save the body. The other thing that people are trying in their clinical trials, well, maybe we can just give a drug that will slow down the immune system a little bit, give the virus a bit more time to do its job, and then we can let the immune system come back and clean up anything that's left over. So those great question, and people are working on that right now in our trials.
So I guess it's just a matter of catching it quickly then, like you said. Okay. Another question from, looks like Valley View Elementary School in Kenora. This comes from a grade 5 student who asks, is it true that everyone has cancer cells and that cancer develops after something is triggered inside of the body?
So another great question. Researchers suspect, although this is a very difficult thing to prove, researchers suspect that even the average healthy human being probably has early stage cancer 5 or 10 or 50 or maybe even 100 different times during your life, and you never actually know it because your body's own natural defense mechanisms recognize those early stage cancers and get rid of them before they can grow and cause a real problem. So again, it's your immune system helping you fight off the cancer. When you actually get the disease, it's those rare cases, maybe 1 in 100, where your immune system just isn't working properly. Maybe it's, you're getting older, the immune system's wearing out, the cancer starts to develop, and the immune system fails to recognize it, fails to stop it, and that's when you actually begin to get the disease. So the reason why people think that might be true, this theory that we get all these baby cancers, but we get rid of them before they make a problem, the reason we think it's true is that every once in a while somebody has a problem with their immune system. So we say they are immunodeficient or immunocompromised. Their immune system just isn't working very well. So an example of that, maybe many students will have heard about the boy in the bubble. He was born without an immune system. He had to live in this bubble protected from infections from outside the world. So every once in a while people like that are born, and as long as you protect them, they won't get infections. But what they do often die of at an early age, not an old age, they'll die from the cancers that start to grow, and the body doesn't protect them from it. The immune system isn't working, so the cancers show up and they just keep on going and going. So there may well be some truth to that. So the big conclusion is usually our body is quite good at fighting off cancer. It's the rare cases when our body fails. That's when we get sick, we go to the hospital, and the doctors need to give us all their help.
Okay, so in terms of cancer prevention, and this is back to the same school from Kenora, is there anything we can do to lower that cancer risk? Or is it the same, are we strengthening our immune system in the same way that we would want to fight off the common colds? Is diet an issue in trying to prevent cancer or anything like that? What can we do to strengthen our immune system?
Right. If we can prevent cancer, that's probably the best thing of all, because who wants to get the disease in the first place? Once you get it, it's very hard to treat, and often the treatments are painful and difficult. So let's not get the disease even to begin with. So cancer prevention is a big area of research. We know many of the causes of cancer. So a big one is tobacco smoke. So people estimate that 30 to 40% of all cases of human cancer are triggered by the use of tobacco, people smoking cigarettes. And not just lung cancer, but also throat cancer and liver cancer, kidney cancer, because it really poisons the whole body, especially the lungs. So if we could get people really to stop smoking, well, that would eliminate, almost half of all cancers. And then, use of sunscreen. There are some types of cancer that are caused by chemicals in our environment. Not very many. Some types of cancer are actually caused by viruses. Not the ones that I'm talking about that cure cancer, but some viruses actually can cause cancer. And we can use vaccines against those viruses to prevent them. So human papillomavirus, now in schools across Canada, people can be injected with that virus, and it can prevent cervical cancer in girls and women, and other types of cancer in men as well. So there are a lot of different things that we can do. So basically, to summarize, maybe 50% of cancers can be prevented in theory if we can get people to eat healthy, don't drink too much, don't smoke cigarettes, avoid too much sun exposure, all that kind of stuff. Use vaccines when they're available. The other 50%, probably just bad luck. You know, our bodies get older, mutations happen, cancers arise. That's when we need the therapeutics.
I see. So in terms of the therapeutics, and you have cancer, you're trying to treat it with your reovirus there. What is special about the cancer cells that this virus attacks those cells alone and not the healthy cells in your body?
So the cancers that the virus, and it's not just this one virus. So if you look at different labs around the world, there were, I think, roughly 10 different viruses that people are testing for their ability to grow in cancer cells and kill them. And each virus has a slightly different way of doing it. So they all have their own unique stories to tell. So in our particular case, in many types of human cancer, there's a particular signaling pathway that gets mutated and turned on roughly in half of all human cancers. Nothing to do with tobacco smoke particularly or other things like that. It's just a mutation that randomly occurs, and it's a rare one, but when it happens, it's very powerful. It turns on all kinds of pathways within cells that cause them to grow. So when a healthy cell says, oh, I have to repair a wound or repair some damage, it turns on briefly, makes some scar tissue, and then turns off, and the body's healed. So it has to have control pathways that tell it to divide and then stop dividing. Well, this pathway, it's called the RAS oncogene pathway. It's turned on in healthy cells and then off when they divide or don't divide. In cancer cells, it's turned on and it stays on. So it makes that cell very, very active. It's growing. It's making lots of proteins and everything that it needs so the cell can grow normally. But a cancer cell, it's just growing and doesn't stop. So the virus uses those same pathways. Oh, making proteins? Terrific for the virus. Now the virus makes more copies of itself. It grows like crazy. It's like, a little kid going to Disneyland. Fantastic. It loves it. So the virus is growing even faster than the cancer cell because it's using those same pathways, and it outgrows the cell, kills the cell. Now there's more virus spreading around. It finds more cancer cells, kills them, until after 8 or 10 days, the tumor is gone.
Right. So we hear about resistance with antibiotics. Is there any chance that the cancer cells may develop a resistance to the virus?
So actually, my lab was the first one in the world to discover, and we discovered this, just over 10 years ago, that this possibility of developing resistance to viruses, you're trying to kill the cancer, but the cancer is trying to escape killing, so it will have more mutations, and we discovered that this can happen and how it happens. At first, people thought, oh, no, it will never happen. The viruses will kill all the tumor cells. Don't worry, but actually it can be a significant problem. We also then discovered ways to get around that resistance so that we can still kill the cancer even if it's resistant to the virus. So we've got different tools that we can use to overcome that resistance, and they appear to be working.
Okay. Just while we wait for more questions to come in, I noticed on your website at the University of Calgary there that you're doing some work with biobanks. Can you tell us what a biobank is by any chance?
Sure. Okay, so I'm the director of the Alberta Cancer Research Biobank, supported by the Alberta Cancer Foundation. So they give us money to collect tissues, and those tissues come from cancer patients. So people get cancer, they go in for surgery, we collect some of the tissue, we remove the tumor. We try to get, if it's lung cancer or prostate cancer or breast cancer, we remove that tumor tissue. Hopefully, the surgeons will get all of it, and that will be part of the strategy to treat the cancer and to cure the patient, so we hope it succeeds. In the meantime, we've got this great big lump of tumor. And so what we do is we save little fragments of that tissue. We store them in these giant freezers under conditions where the chemical and biological properties of the tumor are preserved, and we use that for research. So we look at the different genes that are destroyed or mutated in the cancer. We look at the protein pathways that are turned on or not. We try to understand what makes any particular person's tumor unique. And what we find, to make a big summary of many years of work, not just in my lab, but in other labs across Alberta, across Canada, and around the world, is that every person's cancer turns out to have its own story to tell. Yes, a lot of people will get lung cancer. Many people get breast cancer. Many people get prostate or colon cancer. And you might think, oh, well, if you've got breast cancer, well, you get this therapy. If you have lung cancer, you get that therapy. It's not that simple. Even within breast or lung cancer, there are many subtypes. And when we look at the molecular characteristics, it looks like every person's cancer, there will be some common themes, but each one has its own unique characteristics as well. And that will explain how it evolves in the patient, how it grows, how it spreads, and how it responds to therapy. So one person's breast cancer might respond to this therapy, another person's breast cancer might respond to that therapy, and now our diagnostic tools are getting so precise, we can assign therapy more specifically, targeted therapy, better than ever before. So by studying the tissues in the biobank, that gives us clues to how many different types of cancer exist and how they respond to therapy so that we can assign that therapy better than ever before.
It's very interesting. Okay, so we have maybe time for another question or two. So another very good question has come in from Middlefield here on Twitter, and it gets back to the real virus that you're using to kill the cancer cells. Once the cancer is successfully eradicated, is there any chance that these virus cells are going to continue to multiply and cause a problem themselves?
So we were worried about that exact question early on when the trials were beginning. But what we find is that while the patient has cancer, the virus will grow like crazy in the tumor. The tumor shrinks, becomes smaller, and eventually disappears. When the tumor's gone, there's no place for the virus to grow anymore. The host cells, the tumor cells, that allowed the virus to replicate and make more virus particles, it's gone. The tumor is cured. The patient is cured. So then, with no place for the virus to grow, now the body's immune system wipes out the virus, and now the virus goes away as well. So after about 2 weeks, when everything works the way we want it to, after 2 weeks of beginning therapy, the tumor's all gone, the virus is all gone, the patient is cured. Go home, Mr. Jones, Mrs. Smith, you're fine.
Mm-hmm. Mm-hmm. Okay. So before we sign off, I'd like to ask you a question that I ask all of our researchers, and that is, what advice would you have for the viewers today if they were looking to get into cancer research, into the field that you find yourself in today? Is there some pathway you would suggest?
Sure. So I would say it's a very exciting area of biomedical research, probably one of the most active areas if you look, at different countries around the world, and actually Canada has a strong program of research into the study of cancer and its prevention and diagnosis and therapy and all of that. So if you want to get into that area, or maybe it's heart research or brain research, maybe you might want to become a medical doctor doing clinical trials, or like myself, a research scientist. So I don't have a medical degree. I have a PhD, a Doctor of Philosophy in biological sciences, and I specialize in the cell and molecular biology of cancer. So it depends on which way you want to go. If you want to work with cancer patients, you should become a medical doctor. If you want to work with the cells and molecules, then what I do is, in the science area, is the path that you should follow. Either way, you have to have good grades, go to university, get good grades there, study hard, work hard, learn as much as you can, and then you apply either to go to graduate school if you want to follow the science-based path, or to medical school Once you have your undergraduate degree, then you go to medical school, and then you become a medical doctor, maybe a medical oncologist, or a cancer surgeon, or whatever it happens to be, whichever path your future might take.
Oh, that's very helpful to hear. And I'm sure there's multiple ways, like you say, to get where you are, and it's not just one way to get there. So looking at the time, though, it looks like that's all the time we have. So I'd like to say thank you to you, Dr. Johnston, for answering all of our questions today. Thank you to our viewers as well for sending in those questions. They were very, very good. So I'll just give us a quick plug for our next live event, which is next Wednesday, is that? February 10th at 1 p.m., when we'll talk to Brent Sinclair from Western University, who will answer your questions about insects in the cold. So please tune in for that. In the meantime, thank you again, Dr. Johnston.
Thank you.
And bye for now.